My name is Khadija Poitras-Rhea. I'm a licensed clinical social worker, and I am the Assistant Vice President of Population Health at UConn Health in Farmington, Connecticut. Population health encompasses ambulatory quality, performance improvement, and care management. So I have a small team, a small but mighty team, that really works in all of those areas. Nurse navigators that focus on the care management side, and then also a team on the quality side and a team that focuses on performance improvement. We have about 50,000 patients that are attributed to our primary care practice, and those patients may seek care at multiple locations, right? So they see us for primary care, but maybe they go to multiple hospitals within the state and outside of the state. They're also, transitioning constantly, between acute care and also skilled nursing facilities. And when you're trying to manage all of those transitions and sort of, outreach patients in a timely manner, it really is a challenge, especially in our state because there are so many health systems in a small radius. That's one of our biggest challenges, just trying to coordinate that care. Another challenge we've seen especially since the pandemic, is just an increase in patients that are struggling to meet their basic needs. A lot more referrals for social determinants of health, a lot more sort of unmet behavioral health needs, and we've been really challenged to find resources for those patients. The way that we currently address transitional care management is through our platform, Bamboo Health. So we assign patients based on the discharge information that we receive on a daily basis, and those work assignments go to our nurse navigators, and the nurse navigators contact patients within 2 days of discharge. And they coordinate their follow-up appointments. They make sure that they have received their meds, that they understand their discharge instructions, and really try to close that loop so that the transition home is seamless. We also utilize Bamboo Health to identify our ED high utilizers, and those patients are assigned to our community health specialists, and the community health specialists contact them and do an in-depth social determinant of health screening to understand what the barriers are, why patients are coming into the ED so frequently, and really try to get them reconnected with their primary care provider to close the loop and make sure that they're getting the care they need and any of the challenges in terms of social determinants are addressed. We are very proud of the work that we've accomplished with transitional care management. We set out to increase the capture rate and make sure that we were addressing all of our patients, not just those that were seen in our health system. And by leveraging Bamboo Health, we were able to increase our transitional care management capture rate and the associated revenue by 300%. So to see how far we've come, increasing that capture rate by 300%, and the dollars associated with that have been fantastic from a leadership perspective, but also all of those patients that we would have never been able to connect with because they were outside of our system. So really focusing on bringing them in, re-engaging them, and having that contact with primary care has been huge. So very proud of that.